So you should be seeing the US epi curve. No, it's a pretty steep rise, 45,000 cases yesterday, 252 deaths. And if you go to Alabama, the curve is even steeper. We're now up over 1,000 cases a day yesterday, or the average. Hospitalizations are rising significantly. We're stuck. 34% fully vaccinated, 42% at least one dose. So this is the dashboard that I'm following. On the New York Times tracker, you can do your own custom dashboard. And this is what I look at every morning, first thing. And you can see we're not in a good place here. Alabama, we're now at 23 cases per 100,000. And most of last year, we were using 25 as sort of a metric for action. You've seen the communications this week from the system office and from President Watts. Some of the other metrics that we're following and that we're following closely to make data-informed decisions about what we do next include, in addition to cases per 100,000, vaccination rates, age-specific hospitalization rates, occupancy of isolation beds on campus, and cases among employees and students. In an early morning call this morning, we heard that at UAB hospitals, according to Jeannie Marazzo and Rachel Lee, the age for those being hospitalized is trending about a decade earlier or a decade younger than what they were seeing in January. We know that we're having breakthrough infections, that is an infection in someone fully vaccinated. And we talked earlier this morning about how those cases are presenting. We had a case in the school in a graduate student. There was a case earlier this week in a medical student, and they were very similar: young, healthy, mild symptoms, the common cold kind of symptoms. So these are the things that we've got to be concerned about. I did echo what was in President Watt's message, that for people who are unvaccinated, you're expected to mask up indoors. And the note that I sent out to school leadership is that if you know that a person is unvaccinated because they have told you so, not that you have asked or that you have suspicions, but because they've told you they're unvaccinated and they are unmasked, then ask them to mask. And if they refuse, then ask them to leave the building. I'm very serious about this, and then call me immediately. Where are we on campus? Where are we with what we're thinking about for the fall semester? And when will we make final decisions? I know that it's extremely difficult working in an atmosphere of uncertainty. To repeat what we were talking about earlier in a meeting with department chairs, it's the proverbial sports analogy that it's going to be a game time decision. And I understand the difficulty that puts all of us in. What I would be saying to faculty who are teaching in the fall at this point, at least today, I'm not saying that you need to immediately turn your syllabus inside out and convert it to an online course or a hybrid course. But I think you need to look at your calendar. And I think you need to think about preparation time for needing to do so if we have to pivot, and to think about things such as if we have to mask up indoors, if we're required to mask up indoors, What is our current inventory for PPE? These are the kinds of things on our to-do list to be ready to pivot that I think are important for all of us to have.
This is the cases, not hospitalizations by district. And to me, what's most alarming is what's going on down in Mobile. The attack rate right now in Mobile is the highest we've ever seen in all 3 surges of this pandemic. The RT is nearly 2.5. We've never seen an RT that high in Alabama.
Did you say 2.5?
I said 2.5. The only RT that's been higher than this was observed in Tuscaloosa and Auburn when students went back to school for the first 3 weeks of campus back in August. It was very isolated and very short. It was a 3-week surge back then. But this is really, to put it in perspective, if we see the same thing in Jefferson County, our cases are going to be higher than they've ever been. So there are some differences. Mobile has a lower vaccination rate than Jefferson County, but still it's definitely something that we need to be concerned about and watching. If I had to guess, it's probably 2 or 3 weeks before it moves to Jefferson County based on what we saw when the cases marched down from the Dakotas last fall. That's probably how much time we have. But this is definitely going to be problematic if we see transmission rates as high as what Mobile is seeing. They're exponential and they're not slowing down. So this is really something we need to keep our eyes on. The other 2 lines that are growing rapidly are the southeastern and southwestern region. So you're starting to see those cases first from Mobile, then bleeding into the counties that all touch Florida as well. And Florida is experiencing very high case growth as well. So I think these are just cases that are really kind of coming up from the south and they're going to push north. We're also surrounded by Arkansas, Missouri, Louisiana that are experiencing the same attack rate. So I really do think we're going to be in for a challenge. I think one of the things we're talking about on ICC, to give you guys an incident command center for COVID, to get people an idea of the conversations we're having. What this means is likely that the outbreak will be centered in Birmingham somewhere around the first 2 weeks in September, and probably means high levels of absenteeism from in classrooms. It could be as high as 30 to 50% in the classroom in that 3-week period with students that are in quarantine or isolation, depending on whether they're a positive case or they've just gotten close to a positive case. So it's definitely something we have to plan for. When I'm modeling this, I'm assuming that no one's going to mask and no one's going to change their behavior. But maybe that will be wrong.
If you go on Facebook to Alabama VCN, Vaccination Network, or Vaccinate Alabama on Twitter, we're pushing out messaging constantly on that. Of course, we don't have a lot of people following, but we are pushing it out. So what we're doing is we've got 7 different projects where we're doing focus groups and interviews, 3 of which are in Jefferson County, basically. One's a little broader than that, and then 3 in the Black Belt. And what we're doing is we're asking our participants, we're showing them messaging, we're showing them slides and images and saying, does this resonate with you? Does this, is this something that would make you change your mind about getting vaccinated? And some things that we're finding is that a lot of the participants are telling us that negative messaging is not effective for them, that positive messaging is better. And that if we, like we've got one with a grandfather hugging a grandchild, that kind of messaging is helping a lot. One of the other things that we're finding, and we're having to shift our messaging just a little bit, what they're telling us is that they're more afraid of the vaccination than they are of COVID. And it's interesting because we've had several groups that we've talked to And they're like, yeah, I know 3 people who died after getting the vaccination. And it's always 3. I don't know why it's 3, but that seems to be the common denominator. But essentially what they're saying is I'm afraid of the vaccination. I'll take my chances with COVID, because I know a lot of people who had COVID and it wasn't serious and that kind of thing. And so we're trying to do a lot of messaging out there that this is Delta. This is a game changer, and you've got to get vaccinated even if you hadn't considered it before. So we're trying to push positive imaging, and we're trying to push that this is a very serious variant that you have to go get vaccinated for.
UAB was selected in phase 1, which was the protocol development phase. So that ended about a week and a half ago. We just submitted our reapplication to be part of this NIH initiative today. So that went in this morning. I think a lot of people were involved in our initial application, which was really quite an ambitious and exciting project.
Emily, let me, sorry to interrupt. Let me ask you to drop back just a little bit and give us a thumbnail about what this is.
So yeah, this is an NIH initiative, cross NIH, reporting to the Office of the Director, and I think mandated by Congress to study the pathophysiology, natural history, and treatment options for people with long-term symptoms of COVID. There have been reports, with quite a broad range of the number of people with post-acute symptoms, and a really, really broad range of what those post-acute symptoms are. And affecting essentially every organ system. Some of the most common ones are some neurological complications, pulmonary complications, but we're also seeing, continued GI symptoms, cardiac damage, other things. What that is and what's going on is really not very well understood or known. It's probably a whole bunch of different things that are going on that kind of get lumped into this long COVID or long hauler syndrome. So the NIH has a mandate to really answer all of the questions about long COVID, which they're calling post-acute sequelae of COVID, or PASC. And so in March, they put out a request for applications for a meta cohort, as well as a couple of other big projects. So electronic health record project, autopsy project, a pediatric cohort, and then the adult cohort. UAB was selected as the lead institution for a Deep South consortium to participate in the development and hopefully eventually the recruitment and conduct of the adult cohort. I think that it's a complex project. I think that trying to coordinate across essentially the entire US and hundreds of investigators is quite a challenge. So we had come up with quite a big and ambitious project. It's certainly scaled down in scope. What we sent in this morning as our reapplication is much smaller in scope. So about 1,000 people total across the Deep South recruited into this cohort. Follow-up of up to 4 years post-COVID. One of the interesting things about this is really designed as sort of an open science project. So even though I am one of the MPIs from UAB, along with Jeannie Morazzo, who's our contact PI, and Nathan Erdman, we're not the ones who are necessarily going to be doing the science. So I think that the data will be going to a centralized data coordinating center, and biospecimens are going to a repository. And it's not clear exactly how the science will get done, but I think that that is going to be a resource that will be open to.